This module addresses the scope and standards of practice for nurses who specialize in the health care of people with intellectual and other developmental disabilities. It is divided into two parts. The first part will review the American Nursing Association scope and standards of practice, and the second part will review particular aspects of the DC Nurse Practice Act. This is the second edition of the American Nurses Association Scope and Standards of Practice. These standards are authoritative statements of the duties that all registered nurses in this specialty are expected to perform competently. We'll first begin with the American Nurses Association definition of nursing from their social policy statement. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, and alleviation of suffering through the diagnosis and treatment of human response and advocacy in the care of individuals, families, legal guardians, communities, and populations. You can see that although this definition was developed for the broad practice of nursing, it is particularly suited for the support of people with intellectual and developmental disabilities. All nursing functions that these scope and standards of practice address, as well as the DDA health and wellness standards, are all based on the nursing process. In this diagram, you'll see on the left that the nursing process is often conceptualized as the integration of singular actions, the action of assessment separate from the diagnosis, separate from the identification of outcomes, separate from planning, implementation, and then finally evaluation. However, in fact, the nursing process in practice really represents a single feedback loop from evaluation to assessment. It relies heavily on bi-directional feedback loops from each component, so that as you are looking at and beginning with assessment and developing a nursing diagnosis, you may need to go back to the assessment process as new information comes to you from the person with a disability, from their support staff, from other professionals involved in the treatment planning. So too, as you set forth a plan and share that with other members of the interdisciplinary team, you may need to go back and relook at what your outcomes identification should be. Again, this is a continual process that is not bidirectional, but in fact, that is not unidirectional, but in fact, bidirectional. This set of scope and standards of practice can be used in many settings, both for the registered nurse's individual practice and also for the broader healthcare system supporting people with intellectual and developmental disabilities. These standards should be referred to in the development of any quality improvement system, either at the agency level or in a governmental level. Regulatory systems should reflect these scope and standards of practice. They may also be used in the development of healthcare reimbursement and financing methodologies, the development and evaluation of nursing service delivery systems and organizational structures, any certification activities, position descriptions and performance appraisals, the development of agency policies, procedures, and protocols, the development of educational offerings, and finally, the establishment of legal standards of care. Depending on your role, whether it be the clinical nurse who is delivering primary nursing services, a director of nursing services for a large community-based service agency, or a director at a governmental agency level, there is something for everyone in the scope and standards of practice. These scope and standards of practice can also be used in the development of position descriptions and performance appraisals, the development of agency policies, procedures, and protocols, the development of educational offerings, and establishing a legal standard of care. Whether you are the clinical registered nurse providing direct nursing services to a person with intellectual and developmental disabilities, whether you are director of nursing for a community-based service organization, or whether you are a leader within a government organization, these scope and standards of practice have something for everyone. As we begin a review of all of the standards and their accompanying competencies, you may want to download a table that has been prepared that allows you to do a self-assessment of your own competency level. This review process will inform you as to whether you in fact are demonstrating competencies in these areas. You'll also be able to identify which competencies are not involved with your current practice level and identify areas where you may want to receive additional training or perhaps seek mentoring to further your competency level. This checklist is for your information and for your own personal growth, which is also part of one of the competencies that we will review later. I do encourage you to do that and see what you can learn about yourself. The first standard has to do with assessment. The registered nurse who specializes in the support of people with intellectual and developmental disabilities collects comprehensive data pertinent to the person's health and/or situation. Let's take a look at each of the competencies under Standard 1 assessment. The registered nurse is responsible for collecting comprehensive data that does not just include the physical aspect of health, but also how the person is able to function. What is the status of their psychosocial demeanor? How are their emotions, their cognition, their sexual being, their cultural background? Are there any issues that are age-related? How is their health impacted by their environment? What is their spiritual or transpersonal status? Are there any factors of their economic status that impact their ability to promote their own health care? These assessments need to take place in a systematic process for which DDA has provided you with 2 different nursing assessments that you can use depending on the person being assessed. Assessment is ongoing, so while we know that there are annual assessments required, there are quarterly reviews required, in fact, any indication that the registered nurse has that a person may have had a change in any one of these components requires additional assessment. This assessment involves your observation, your interviewing skills, you're interviewing the person, interviewing the people who spend the most time with that person, whether it is direct support professionals or family members, people who they spend their day with. It also involves the use of screening tools. So we have the Braden tool for assessing skin care. We have screening tools for dementia, for depression. So all of this information has to be pulled together along with other diagnostic tests that may be conducted by medical specialists or other members of the interdisciplinary team. You want to be able to develop some problem-solving tools appropriate to people with intellectual and developmental disabilities. So that may include tools that are part of the ISP process or other information that can bring to bear the assessment and the development of diagnoses. Your interviewing process and your observation will allow you also to elicit the person's values, preferences, and expressed needs. So tools such as person-centered planning tools are really vital to be able to develop competency in this area. And then you want to be sure to involve the person with a disability and any other people that they identify as important to them so that your data collection is indeed holistic. Your assessment also needs to identify if there are any barriers to effective communication and any recommendations that you have about the need for appropriate adaptations. For example, does the person's cognition, their actual intellectual disability, pose a barrier to communication that needs to be imparted to other people within the healthcare system with whom they interact? Does the person have any physical barriers? Do they have severe cerebral palsy that will require special adaptation during medical exams? Are there psychosocial or emotional problems that healthcare providers need to be aware of in order to receive optimal health care? What are the person's abilities in the area of literacy? Are they able to read some simple instructions? Is that a way to help teach them about their health status, help them learn to take their own medication, or in fact, are they illiterate? What are the financial concerns? Does this person have resources to allow them to access some services in the community, say to participate in an exercise club? What are the limitations of their Medicaid or Medicare insurance, especially as it has to do with accessing pharmacologic agents? And finally, are there any cultural barriers? You may find that cultural barriers are important to assess even from the person's family of origin. Your assessment must also be able to identify any personal attitudes on the part of the person, any values or beliefs that impact their health care. For example, is this someone or their healthcare decision maker who may have an aversion or a fear of certain type of medications or treatments? Family dynamics play an important part on the healthcare planning, and if there are any family issues, if there are any disagreements among the family, or if the family has some very expressed wishes for how they want to be informed about healthcare issues, this should also be part of the comprehensive nursing assessment. Collecting your data in what is really a long-term care setting is very different from the data that is collected, for example, on an acute care hospital unit. The registered nurse, in some instances, is coming into an agency and needs to get to know all 15 people assigned to her care. In this instance, the nurse will need to prioritize: how am I going to gather the most succinct information about the people for whom I am responsible, and then be able to go back and do a more thorough record review, conduct additional interviews, so that once you get into a rhythm of your nursing practice in this setting, you will find that you are continually gathering assessment information and adding it to your assessment documents. You must also be sure to use appropriate evidence-based assessment techniques. So, for example, we have assessment instruments to assess fall risk that have been developed specifically for people with intellectual disability. There is a Glasgow Depression Screening Scale that was developed especially for this population. And finally, the dementia screening for people with intellectual disability. You need to keep up to date and make sure that you are aware of any new instruments or resources that help you in the conduct of a comprehensive assessment. The registered nurse must also be able to synthesize data and information from a number of sources. This includes the person with intellectual disability, their family member or legal guardian if one is in place, other members of the interdisciplinary team, and looking at the person's environment in multiple settings, in their home environment, at their employment site if they are employed, or in a day program. So this information then must be pulled together and synthesized to determine what is appropriate to include in the assessment and which factors need to be addressed in the health plan. The registered nurse must also be sure to apply any relevant ethical, legal, or privacy guidelines in the collection of this information. And for this, it is important for the nurse to be aware of all of the HIPAA regulations in the transmission of health protected information. The registered nurse must recognize that people with intellectual disabilities do have authority and autonomy in identifying their preferences. And if there is a difference, it is not simply to be overlooked because the person's preferences or desires compete with recommendations from the medical team. Is the person competent and have the capacity to be able to make those decisions, then those decisions must be honored. If the registered nurse, as part of their assessment, believes that there may be some factors, either medical or psychosocial, that are affecting the person's ability to make decisions, then that must be discussed with other members of the team for further evaluation. And finally, all of the documentation must be stored in a retrievable format. DDA has given clear guidelines on the type of assessment formats that are to be completed and standards for completing the healthcare management plan, which is the end product of the nursing assessment. The competencies in Standard 2 address diagnosis. So the nurse who specializes in the healthcare of people with intellectual and developmental disabilities must analyze assessment data to determine the diagnoses or issues. It is this analysis that requires good critical thinking. The registered nurse's assessment allows for the formulation of nursing diagnoses or the identification of medical issues from the data collected. Once the nurse has identified the diagnoses or the issues, the registered nurse needs to refer back to the person with a disability, other members of the interdisciplinary team, to validate what they are identifying. For example, a nurse may decide that a person needs to address a problem of obesity, and while the facts are clear in terms of the person's weight being outside of recommended ideal body weight, if in fact the person is not at a stage of readiness to address it, that weight issue may take a lower priority to another issue for which the person is concerned. The registered nurse has an obligation to identify both actual and potential risks. An important part of community nursing is taking a look at the full environmental picture and identifying conditions for which the person, due to their age, due to their cognitive level, due to the presence of multiple chronic illnesses, may be at risk, so that we are preventing any type of secondary disability. All classification systems should be those that are standardized. So for example, the nurse may want to refer to a nursing diagnostic manual. In referencing mental illness problems, you want to use the diagnostic and statistical manual language that is in current use. And the nurse may also want to reference a text such as the Nursing Interventions Classification 6th edition that is edited by Gloria Bulacek. All of the diagnoses need to be put together, and in this case, the diagnoses need to appear on the healthcare management plan in a way that help facilitate determining what are the expected outcomes and what is that plan. Again, the nursing assessment leads to, in a logical way, the development of the healthcare management plan. Standard 3 discusses the competencies required for the identification of outcomes. The registered nurse needs to identify expected outcomes within a plan that is individualized to the person with a disability and their situation. Outcomes should focus on the person, be part of the person-centered thinking process. So information gathered during the person-centered thinking process should be referenced in the development of these outcomes. Outcomes need to be clear and concise statements. They should not include jargon, but information that anyone can understand. All outcomes need to be measurable, time limited, and realistic for what the person is able to agree to engage in. For most people with intellectual disabilities, the outcome should be a mutual decision between the nurse, the person, and any healthcare decision maker. Identifying outcomes is important because it individualizes the plan of care. It promotes the person's participation to the full extent possible. It communicates that plan of care to other people. It lets you know exactly this is the target blood pressure range we are hoping for. This is the target hemoglobin A1C, 3. This is what we're looking for in terms of seizure management. Are we hoping to have no seizures, or for that person, would a range of 2 to 3 seizures per month be optimal outcome? So it therefore promotes that accountability. It's your yardstick to also measure your interventions. If you've established realistic outcomes, then those measures should be achieved. We should not forever, for example, be including on a health plan that this person is going to have a 5-pound weight loss and that 5-pound weight loss is never achieved. In examining the specific competencies associated with the identification of outcomes, the registered nurse needs to develop those outcomes in partnership with the person with disability and other members of their support team. Outcomes should be culturally appropriate, related to the person's expressed values. The outcomes have to consider any type of associated risk, benefits, cost, the support of scientific evidence, the trajectory of the condition. So, for example, if someone has just been diagnosed with severe congestive heart failure, there's likely to be very little benefit for that person to engage in a rigorous exercise program. The exercise program or the goals around mobility must take into consideration the condition of the person's cardiac status. If the person is on a trajectory of a condition that is deemed to be in a terminal stage, then again, those outcomes need to be adjusted. So what may have previously been an appropriate outcome for weight loss may, in fact, in a terminal condition, be modified so that the person is having a more liberalized diet and that the diet is including the person's favorite food of the shortened life expectancy foods because of the shortened life expectancy. The articulation of expected outcomes need to take into consideration the person's values and in some instances the values of their family. This is particularly important when discussing end-of-life planning, advanced directives, or even sexuality. These 3 areas tend to be quite value-laden, and you need to follow the direction of the person And if the person's decision-making is being compromised because of the influence, perhaps of family members, that needs to be worked out in support of that individual. The registered nurse who is competent in the development of expected outcomes helps to facilitate continuity of care in the event that another registered nurse steps in to be able to implement the health plan as articulated. As mentioned before, the registered nurse needs to continually monitor those expected outcomes to make any changes that are required, either for more intensive healthcare supports that are indicated, or sometimes because of a change in the goals of what is expected. This is particularly important during end-of-life planning. And again, to wrap up, all of the expected outcomes should be written in concise terms that are measurable and include an estimated time in which to attain those expected outcomes. This helps to promote accountability. The fourth standard has to do with planning. The registered nurse who specializes in the health care of people with intellectual and developmental disabilities develops a plan that prescribes strategies and alternatives to attain expected outcomes. According to the DDA Health and Wellness Standards, that plan is in the form of the health care management plan that is the responsibility of the registered nurse. The health care management plan needs to be individualized to that person, and making sure that it takes into consideration the person's preferences and choices, their chronologic age, developmental level, coping style, any technology that will help support the promotion of their health, and the least restrictive environment. The plan needs to prioritize what issues are most important for the person and to the person, following person-centered planning principles in collaboration with the individual, their family, and other members of the team as appropriate. Strategies should address each identified diagnosis or issue that was identified in the nursing assessment. In developing the list of priorities and the interventions, the registered nurse must remember that all interventions should be focused on the promotion or restoration of health, illness, injury, or disease prevention, the alleviation of suffering, and for those who are dying, appropriate supportive care. The registered nurse needs to be familiar with strategies that promote health and wellness across the lifespan, and the planning process and the documentation of that planning should assure for continuity, so that if there is an intervention or an issue that has been resolved, someone should be able to follow that continuity of the resolution of certain issues in the progress note or in subsequent assessment. The health plan should incorporate a timeline for the implementation of the plan, and always consider any type of impact on the person related to economic impact for anything that is recommended in the plan of care. The registered nurse must also integrate any current scientific evidence and research. So the registered nurse must be a continual learner and access appropriate continuing education programs, read professional journals, and seek the counsel of more experienced nurses, mentors, or other members of the interdisciplinary team. The healthcare management plan should provide clear direction to anyone responsible for implementing that plan. And on DDA's recommended healthcare management plan, you know there is a column specifically for the interventions that are the responsibility of the registered nurse or the licensed practical nurse, and yet a separate column for non-licensed members of the interdisciplinary team particularly the direct support professionals. To that point, all of those interventions for the DSPs and non-clinical members of the team need to be written in clear layman's language. The plan must be sure that the practice setting and the way that you interact with the person with a disability or other members of the support team allows for some reflection to implement that nursing process that continually requires for a reflection or evaluation of, are these issues still relevant? Are the issues prioritized appropriately? And are the implementation suggestions still relevant? The health plan must reflect all current statutes, rules, and regulations. So that includes the health and wellness standards by DDA, but also any other regulations put forth for intermediate care facilities or the Department of Health. The plan needs to be continually modified if there are changes that are identified in the assessment, change or lack of response in the person's response to these interventions, or a change in the person's preferences. The plan needs to document the care in a way that is using respectful person-first language and all recognized and current terminology. Standard 5 references all of the competencies related to the registered nurse's implementation of the identified healthcare management plan. At this point in the scope and standards of practice, you will begin to hear some synchrony with previous standards. So starting off with the first competency for Standard 5, implementation, it refers to the registered nurse's obligation to partner with the person with a disability or their family members or legal guardians and other people important to that person. All of the interventions that are identified in a plan must be carried out in a caring way toward that person with an intellectual disability, again respecting their wishes, respecting sometimes the changes that may occur from day to day when a person perhaps is having problems adhering to the stated plan, and the implementation guidelines need to make it clear and training provided to the direct support staff so that they are clear in what to do when the person may not want to adhere to the recommendations in the identified plan. Implementation of the plan is expected to use current technology so that health parameters are measured and recorded accurately. Is ongoing training required for the direct support staff or for the licensed practical nurses to make sure that the data that they are collecting is accurate, and the measures used should enhance the nursing practice. Finally, all evidence-based interventions and treatments should be used specific to that diagnosis. So again, this requires that the registered nurse maintain current information or seek it out when the registered nurse does not have that. The implementation of healthcare needs to be holistic, sensitive to the needs of diverse populations when you are serving diverse populations, and ensure continuously that you are applying the most current knowledge of major health problems, and particularly those that affect people with intellectual and developmental disabilities. In the implementation of healthcare, remember to become familiar with the available resources within the community. Everything isn't meant to be given within the narrow confines of the ICF or the Home and Community-Based Services waiver. While it is wonderful to have those resources, the first source or the least restrictive source of health care should be those resources that are in the community. So for example, if someone desires to lose weight, that is an outcome that has been agreed upon to be important for and to a person, then the first place to look is perhaps, is there a Weight Watchers club that the person could join? Is there a support group at the local community center or a local church? You don't have to first go to the nutritionist that is available through the waiver. Healthcare needs to be a collaboration with other nursing colleagues within or outside your organization, with other healthcare providers, so that the best possible care can be provided. It is important to remember to accommodate different styles of communication. Some people desire, particularly when communicating with family members, very authoritative view. They may prefer to get their information from the physician on the team or the medical director of the ICF. Other people may prefer some of the information to come from someone who is more trusted. This is especially important if, as a registered nurse, you are new to an organization and new to the people you are supporting. You want to use the people who have worked with that person for a longer time, who may have developed better working relationships with that person or with that person's family, and almost use them as a cultural broker until that person or the family members or the guardian get to know you as the professional that you are. In some instances, the expressed preference of the person or their family may include the request to integrate complementary healthcare practices along with traditional health practice. The nurse needs to identify those preferences and to be able to assess if those complementary healthcare practices are safe in complement with the traditional practices, and to inform the primary healthcare provider or specialist about the use of complementary practices. Implementation of the plan must be in a timely manner. This is particularly important and sometimes challenging when the registered nurse is not continually at a particular site. You may have responsibility for people across 3, 4, even 5 sites, and determining how frequently you need to make your assessments, what day of the week those assessments should be made, when are times that you may have to go outside of your planned visits or your routine visits because you have been notified of a change. The implementation of healthcare should always try to promote the capacity of the person with an intellectual disability to achieve optimal health. So you want to support people, but you don't want to do something that that person is capable of learning how to do. For people for whom you use Nursing Assessment Form B, the probes within that assessment are specifically designed to help assess the person's level of knowledge about their healthcare conditions, and then allow the registered nurse to plan a care that is focused more on the education of the person with intellectual disability about their health and about how they can maintain or improve their health status. And remember that finally, the implementation of a health plan requires the documentation of any changes to that health plan, or if the registered nurse recognizes any omissions in the implementation of a plan. Omissions are bound to occur, but that needs to be documented along with the plan of what do you intend to do about that. Is this omission reflecting a one-time occurrence, or is it a reflection of some better systems that need to be put into place? You are. Standard 5A refers to the coordination of care. The coordination of care is identified as an essential responsibility of the registered nurse in the DDA health and wellness standards. The registered nurse who specializes in the health care of people with intellectual and developmental disabilities plays an important role in the coordination of healthcare within the wider healthcare system of the community. The registered nurse organizes the various components of the healthcare management plan. The health plan is always looking to maximize the person's independence and to maximize their quality of life. The registered nurse assists the person with a disability, their family or legal guardian as appropriate, to identify, are there other options for alternative care? Are there times when a second opinion is indicated? Are there choices to be made in decision making regarding the treatment of seizure disorders, the treatment of various cancers, and helping the person and their healthcare decision makers identify information that allows them to make informed choices. Coordination is really highly dependent on the ability of the registered nurse to communicate effectively with that person or their healthcare decision makers, particularly during transitions in care. And for this, I would draw your attention to the transition of care document. This is a document that is not intended to be placed in the person's health record, but is something that assists you as the registered nurse to follow a systematic path when a person is transitioning from the hospital back home. I suggest that you review it and use it on a regular basis. The registered nurse also has a very important role in advocating for the dignified and humane care by others on the professional team. This is particularly important in the wider healthcare community with people who may not be as familiar with the needs of people with intellectual disabilities. It is known that people with intellectual disabilities experience healthcare disparities, so the nurse must always be on the lookout for situations in which the person is receiving less than optimal care. All efforts to coordinate care need to be documented in the progress notes. This includes making referrals to other disciplines, coordinating referrals with the primary care provider, and providing supervision and direction to the direct support professionals who may not possess a broad range of health literacy. There's the need for continual assessment on the part of the nurse of your staff's ability to implement the healthcare plan and provide training when it is identified that the staff needs additional training, or perhaps there has been a change in the health status of the person with a disability and the staff require additional training. The registered nurse must continually work to make sure that the person with disability or their health support team, their healthcare decision makers, are kept informed about the health status. This is particularly important during times of medical workups, during times of hospitalization, and continually provide information about available healthcare resources in the community, remembering that the strategies and the resources should always be sought out that can be provided in least restrictive environments. Standard 5B draws our attention to health teaching and health promotion. The registered nurse employs strategies to promote health within a safe environment. The Surgeon General report, Closing the Gap, identified that people with intellectual disabilities often do not have access to good information that helps them to live healthy lifestyles. They don't have information that is provided to them in a way that they can access it and easily understand it. So the registered nurse who supports people with intellectual and developmental disabilities needs to be able to develop teaching that includes topics such as the healthy lifestyle, the reduction of high-risk behaviors, and this includes sexuality information for good sexual health, how can the person who may have chronic illness complete their activities of daily living as independently as possible? And finally, the emphasis on prevention of healthcare problems through good health screening and accessing immunizations. The registered nurse will use health teaching methods that are appropriate to the situation and also incorporate the person's values, beliefs, their readiness to learn, language preference, and other considerations individual to the person. When conducting health teaching, it is important to regularly obtain feedback from the person to evaluate, are your strategies for teaching being effective? You may, for example, conduct a more formalized kind of class or session on the use of strategies to prevent sexually transmitted disease, and you then may want to check back with that person before they're going out on a date to see, in fact, if they are using the strategies that you had discussed in that more formal setting. The registered nurse should identify, are there any information technologies that help communicate health promotion? Are there videos or TV programs that can be accessed? Thinking about the use of tablets as ways that people can access reminders about what they can be doing to independently promote their health. And then finally, it is important for the registered nurse to be aware of and communicate any intended effects of medications or treatments, along with any potential adverse effects of the proposed therapy, that the person and any healthcare decision maker clearly understands that and can provide informed consent. You will recall at the beginning of the program that we discussed the nursing process, and evaluation is one step in that process. Standard 6 refers to the need to evaluate progress toward the attainment of outcomes. The registered nurse needs to develop a system of evaluating on a continual basis. Some of these systems are required by regulation, so that in an intermediate care facility, that evaluation must be completed at least quarterly. There are less clear guidelines in a waiver setting, but the bottom line is that the registered nurse must be responsible for determining through continual assessment how often the interventions and the expected outcomes need to be evaluated. This evaluation has to take place with the input from the person with disability or any other people within their circle of support, and also in collaboration with other professionals on the team to evaluate the effectiveness of the planned strategies, assess the person's response to these interventions, and determine if, in fact, the expected outcomes are being attained. The registered nurse is expected to document the results of the evaluation and then use ongoing assessment data in the revision of the stated diagnoses, the expected outcomes, the plan and intervention as needed. The information from that evaluation must be shared with the person with disability to the extent possible, and others involved in the care, others who have responsibilities in care, and also taking into consideration any state regulations or licensing requirements for the dissemination of this information. The first 6 standards had to do with the practice of nursing and had to do with competencies that more directly affected the person with a disability. The next set of standards turns to a set of professional performance standards for nurses that look more inwardly at the responsibility of the registered nurse to maintain a high level of professionalism. Standard 7 has to do with ethics. The registered nurse, who specializes in the support of people with intellectual and developmental disabilities, practices in an ethical manner. The registered nurse should refer to the American Nursing Association Code of Ethics for Nurses with Interpretive Statements that was published in 2001 to guide practice. The registered nurse must always act in a way that preserves and protects a person's autonomy, their dignity, their rights, values, and beliefs. Central to this process is the idea of person-centered planning, with the person with a disability at the center of that planning process. The registered nurse is responsible for upholding the confidentiality of the person's healthcare information within all legal and regulatory parameters. The registered nurse often serves as an advocate for the person with intellectual and developmental disability, including developing the person's own advocacy skills, their self-advocacy skills. At all times, the registered nurse must maintain a therapeutic and professional relationship within appropriate professional role boundaries. And the registered nurse must contribute as part of a team to resolve any ethical issues that arise among colleagues, community groups, and the wider healthcare system, including seeking assistance from ethics committees, from the DDA Human Rights Committee, as well as participating on ethics committees when requested. When the registered nurse identifies instances of illegal, unethical, or inappropriate behavior that could endanger or jeopardize the best interests of a person with a disability, they must take appropriate action. They must speak up and question any healthcare practices that seem to invade the person's safety and quality of life. They must advocate for equitable healthcare. That includes outside of your day-to-day practice, outside of the agency that employs you, and may suggest taking part in professional organizations to elevate that advocacy. The registered nurse should participate on interprofessional teams that address ethical risks, benefits, and outcomes. And the registered nurse needs to inform administrators of any risks, benefits, and the outcomes of programs and decisions that could affect healthcare delivery. You are the expert in these areas, and you do have an ethical responsibility to speak up. The registered nurse's obligation is always to support the self-determination of people with intellectual disabilities. And that includes determining what the person would have wanted to have happened if a surrogate decision maker is in place. At times, the registered nurse may be part of a team effort to help the person identify someone who would be their surrogate decision maker in the future, or in the case of a catastrophic illness where the person has not been able to do that ahead of time, to help identify a surrogate decision maker and then help that decision maker understand about what is important to and for that person. The ethical registered nurse always advocates on behalf of people with intellectual disabilities, including supporting them in the event that there is a conflict between their wishes, their stated wishes, and a surrogate decision maker. In all aspects of nursing practice, the registered nurse is responsible for assisting to facilitate those self-determination decisions, including acting within their own organization and within other healthcare settings. The registered nurse acts as an advocate and also refers people to qualified advocates if additional support is required. The registered nurse works to prevent abuse or exploitation. This includes training for the support staff on the recognition of abuse and neglect, and also on the importance of reporting abuse and neglect. The registered nurse assists to make sure that the living arrangement is always one that is the least restrictive, balancing that with the person's needs for appropriate health supports. If the registered nurse's practice is within a special education or general education environment, the registered nurse has an obligation to advocate for the least restrictive environment while at the same time maximizing healthcare supports. The registered nurse also contributes to life planning and advocates for appropriate employment opportunities, including providing information to the interdisciplinary team, to the support team, to make sure that the person's health needs are adequately met, but balancing that with the freedom to pursue desired employment opportunities. There is an ethical obligation to refer to local, regional, or federal assistance programs. This would imply that the registered nurse needs to be aware of what those assistance programs include and eligibility requirements. That may involve partnering with a case manager or other governmental agencies, but again, that obligation to refer implies that the nurse must be knowledgeable of those referral sources. The registered nurse also supports the expression of sexuality. That needs to be consistent with the person's culture, religious upbringing, understanding values, and looking at the level of maturity of the person. Once all of those aspects have been assessed and taken into consideration, the nurse can then provide appropriate counseling. The registered nurse, as part of a support team, contributes to an environment that also protects the person from exploitation wherever they are in the community. The registered nurse serves as an advocate to ensure that all health care is coordinated, continuous, and accessible, and is provided by healthcare providers who are competent in managing the person's healthcare concerns. The registered nurse educates colleagues outside of the support teams who are knowledgeable about the needs of people with intellectual and developmental disabilities. The registered nurse also provides support and resources related to end-of-care planning, the implementation of end-of-life plans, support for people who are grieving or who are experiencing bereavement. And that may also include the support team who may be grieving the illness of someone or their death. The registered nurse is aware of palliative care resources, advocates for access to those resources, and helps to support the person with an intellectual disability and their surrogate decision makers about when it is appropriate to seek palliative care. The registered nurse will advocate for life-sustaining treatment, as well as the refusal or withdrawal of life-sustaining treatment consistent with the person's values. The registered nurse always demonstrates a commitment for the person to receive the information and education to support their own self-care, including managing stress and community connections with other people. Moving on to Standard 8, we are again now looking at standards that reflect the nurse's professional development. And Standard 8 refers to the need for the nurse who specializes in the healthcare of people with intellectual and developmental disabilities to attain the knowledge and competence that reflect current nursing practice. Your participation in this module is certainly moving toward developing those competencies. The registered nurse participates in ongoing educational activities appropriate to where they need to increase their knowledge base and appropriate to the professional issues they face in their practice. This comes through a commitment to lifelong learning, and this comes through self-reflection. The exercise that we suggested you follow in moving along this scope and standards of practice is a good example of that. We're asking you to self-reflect on what areas of strength do you demonstrate in your competencies and what are areas that require further development. This self-reflection will lead to you understanding better where your learning needs are and where are the areas for your personal growth. The registered nurse also seeks experiences that help to reflect the maintenance of current knowledge, skills, and abilities. So this may be requesting to team up with a colleague who has some advanced practice or additional experiences that you do not have. The registered nurse also acquires those knowledge and skills appropriate to the role that they currently hold and the population of people that they are supporting. So for example, you may be a nurse who had substantial experience in a hospital setting, but have had very little experience in community settings, and in addition, in community settings that support people with intellectual disabilities. This is, while you are still licensed to practice, this is an area where you need to advance your knowledge and skills. On the other hand, you may also have had many years working with a pediatric population of children with special needs, but have to become more familiar with some of the issues that face adults who may be more independent and more self-determining. Learning experiences can occur in formal settings, formal workshops, classes that are associated with continuing education units, such as this one, or also independent learning experiences. Again, calling on colleagues to mentor you, to give you advice, to observe your nursing practice to see if there are any areas that can be improved upon. The registered nurse is responsible for identifying their own learning needs based on the roles that you are assuming and also the changing needs of the population and new information that comes to bear from evidence-based research. The registered nurse participates in both formal and informal consultations. You may want to begin a nursing grand rounds with your agency, or if you work in a small agency, calling upon other nurse colleagues to participate in grand rounds with you, or initiating a grand rounds with other colleagues who are licensed in other areas of health practices. And then the registered nurse has that obligation to pay it forward, to share those educational findings and experiences with peers. This could be attending a conference and then sharing an in-service with colleagues. It could be sharing and passing on articles that you have found helpful. The type of work environment that is maintained also contributes to an atmosphere of learning. If you have some administrative experiences, do you make educational opportunities available for your staff? Do you foster an atmosphere where people who may not be performing to their expected standards are encouraged to learn, that there is an atmosphere where everyone learns from each other. This is a very important aspect of continuous learning. The registered nurse is also responsible for maintaining your own professional records that provide evidence of competence in lifelong learning. This connects with our Nurse Practice Act requirements here in the District of Columbia, in which we are maybe audited every 2 years when the license is renewed. The registered nurse is responsible, if they are selected for audit, to produce those records. So you need to take very careful note of various continuing education offerings that you have participated in and keeping those records. The registered nurse uses current healthcare research findings to both expand knowledge and enhance role performance. Where do you find those? Two excellent resources within the developmental disability community are the Developmental Disability Nursing Association. Membership in that association gives entree to online learning modules that are specific to the work expected of the nurse who specializes in this field. And the American Association on Intellectual and Developmental Disabilities, where membership provides access to monthly journals that are of an interdisciplinary nature and also focus on research. Standard 9, Evidence-Based Practice and Research, presents a challenge to everyone, but particularly the nurse who is in a clinical setting. This standard expects that the registered nurse specializing in the healthcare of people with intellectual and developmental disabilities will integrate evidence and research findings into practice. The first competency refers to the registered nurse's practice of using current evidence-based knowledge to guide your practice. So this does require quite a bit of independence to first seek out that evidence-based knowledge and then reflect on, does this match what I currently do in my practice? If not, what needs to be done to modify your practice so that you are integrating this information? And then going back to the nursing process, taking it one step further. Once those new practices have been initiated, evaluating to see whether those practices assist you in reaching the outcomes you desire for the people you are supporting. The registered nurse incorporates this evidence when making changes in nursing practice, not change for change's sake, but change that is moving the practice of nursing forward. As appropriate to both your educational level and your position requirements, do you participate in the formulation of evidence-based practice through research? This is an area that it may not be within your job description to do, but looking for opportunities to perhaps partner with people at a university level or nurses who are advancing their education and perhaps furthering their education through a master's thesis, a doctorate in nursing practice, capstone project, or a PhD in nursing research. Once you have done that research, or even looking at how you have analyzed the impact of changes in practice, sharing that information, those research findings, with your colleagues and peers. Taking the opportunity to participate in research, but also remembering if those opportunities present themselves to be sure that it is what we call participatory action research that includes people with intellectual and developmental disabilities. Keep in mind that when involving people with intellectual and developmental disabilities, you need to have their informed consent and also informed refusal if that is appropriate. Standard 10 refers to the quality of practice and the registered nurse's obligation to contribute to quality nursing practice. Some of the competencies include the nurses being able to demonstrate that they are applying the nursing practice through documentation. How creative is the registered nurse in helping the person with an intellectual and developmental disability devise strategies that help them achieve and maintain optimal health? A lot of organizations talk about quality improvement, but exactly what is that? So quality improvement activities include a myriad of activities. Here are some examples. You may be able to identify which aspects of your practice are really important for quality monitoring. Within our system, we have many entities that conduct monitoring activities. You also want to monitor your own practice to determine if you are reaching those outcomes that you have identified on the healthcare management plans. What are the aspects of practice that are really essential? Then once you identify those indicators, using them to regularly monitor your own work. The monitoring tools that are used by DDA are available to providers, and if you are not familiar with those monitoring tools, you should become familiar with them because they do reflect the standards to which you are held accountable. Quality assurance includes the collection of data to monitor the effectiveness of nursing practice. So the collection of data around positioning, elimination patterns, behavioral indicators all contribute to the quality of health and the quality of life for the people that we are supporting. How do you analyze that data? While there are people within organizations that are specifically responsible for analyzing and monitoring data, particularly around incidents, are you as the registered nurse involved in that? You should be, because your lens on healthcare and the causes of some problems can help to contribute to ameliorating or correcting any problems within your organization. As a registered nurse, you should be routinely formulating recommendations to improve nursing practice or outcomes within your own patient population, within your organization, and within your community. And then implementing those activities. There are many educational opportunities that are afforded through the Nursing Roundtable, through online activities, as I mentioned earlier, through the DD Nursing Association. Implement those activities. Don't just hear about them and think, I'm going to do something tomorrow. You also need policies, procedures, and guidelines that are going to help you be consistent in the implementation of quality practices. Review the practices and policies within your organization. Do they reflect current evidence-based practice? Are they helping to support you to help achieve the expected outcomes, or are they acting as barriers? Participate on interprofessional teams within your organization, within the DD network, in your community. And participate in efforts when appropriate to help minimize costs and unnecessary duplication. Are we advocating for additional nursing coverage simply because out of fear or out of thinking that adding more people is going to somehow contribute to a quality of life? If it is appropriate to add staff to help implement the plan of care or the healthcare management plan, evaluate that. Put some time limits on it. Are we getting to the outcomes that we desire? What are the problems that you see in day-to-day work routines? You've got to speak up. This is part of advocacy to help improve the system. We can't give up. And then finally, you want to make sure as a quality improvement system that you are removing barriers that exist within organizational systems. The registered nurse who is promoting a quality environment provides leadership and helping educate people with intellectual and developmental disabilities, their families, and other legal surrogates. The registered nurse is designing innovations to practice, participating in the evaluation of the environment in which they work. And also evaluating the nursing care delegated to other professionals. In community-based settings, we see much more delegation than we would in a hospital setting. This cannot stop at an initial training. This cannot stop with just initial training. This must carry through to periodically evaluate staff to ensure that they are able to consistently implement the interventions that you have outlined in your healthcare management plan. And finally, the registered nurse participates in professional organizations. You cannot do it alone. We cannot do it simply within the community of the District of Columbia. There are very reputable, long-standing national organizations such as DDNA and AAIDD to assist you in this journey. Standard 11 stipulates that the registered nurse who specializes in the health care of people with intellectual and developmental disabilities communicates effectively in a variety of formats in all areas of practice. The registered nurse, as part of the nursing assessment, assesses the communication format preferences for people with intellectual and developmental disabilities. In addition, the registered nurse must assess their own knowledge of communication skills. So, for example, if you are supporting people who use sign language, there really is an ethical obligation to learn some sign language skills, particularly those related to health care. Also, to learn to assess behavioral changes as a form of communication. Another area of communication that is so essential in the diverse area in which we work, and I'm referencing now the diversity of the support team, is learning about communication patterns and conflict resolution skills. The registered nurse, as that professional licensed nurse, has a higher obligation than other people on the support team to make sure that communication is good, that communication patterns are healthy, that communication problems are not going to interfere with the healthcare quality. The registered nurse must learn to be able to convey information at a variety of levels with people with a variety of skills in health literacy themselves. So this will include the person with an intellectual and developmental disability, family members, legal surrogate decision makers, other members of the support team. So you can see right there you have so many different perspectives, and you need to learn not only to convey that information, but then to be able to solicit that information, to solicit a return demonstration, if you will, to determine if the person has received the information accurately. This next set of competencies really refers to the nurse's ability to communicate when tensions may be high. If the nurse is observing care processes that do not appear to be in someone's best interest, or they observe potential hazardous situations, or perhaps errors in care delivery, how is that information handled? While we need to be straightforward and clear in our communication, this is where the art of communication comes to play, so that the person who you are communicating with can truly receive that information, not have to be put on the defensive about how you are communicating it, so that you can get back to the best interest of the person with intellectual disability. The nurse also has a tremendous obligation in minimizing risks associated with transfers and transition of care. That includes whether someone is leaving your service to go to a different agency and transferring that information, transferring up-to-date information, and also in the transition periods that occur when people are in hospitals. We want you to refer to the transition of care guide that is intended not to be placed in the person's medical record, but as a guide for the registered nurse, service coordinators, Qs, even family members, to make sure that when the person is transitioning from the hospital to home, you have all of the information needed to, in effect, a safe transfer. The nurse is obligated to give their professional perspective in all discussions. It would never be appropriate for the nurse to sit silently because they felt that they were the only one who maintained a certain position. You cannot let personal emotional situations impair or impede your ability to communicate your professional judgment. In fact, this would be unethical. The registered nurse must maintain current knowledge of adaptive and communication skills of the person with an intellectual and developmental disability. This is usually the primary purview of the speech-language pathologist, but the registered nurse most likely will have more frequent contact with the person with an intellectual disability, and also has contact with that person in different venues, looking at healthcare. So if there is something that, for example, a person has just recently been diagnosed with arthritis, and so with that diagnosis, we know that it is a chronic illness, we know that pain is an important factor that could impede the person's quality of life. It is important for the registered nurse to collaborate with the speech-language pathologist to help determine how will this person convey information about their pain to their support team. And all of these competencies ultimately have to do with the facilitation of communication between the person with a disability, members of the support team, always building on the adaptive abilities and communication strengths of the person with an intellectual and developmental disability to be able to articulate what is important to them. The registered nurse, who is part of a team that supports the healthcare needs of people with intellectual and developmental disabilities, demonstrates leadership in the professional practice setting and the profession itself. The registered nurse, who is part of a support team to support the healthcare needs of a person with intellectual and developmental disability, demonstrates leadership in their professional practice setting and in the profession itself. This involves maintaining the highest level of accountability for the quality of care that is given. The registered nurse abides by the vision and goals and plans to implement and measure progress within the context of their organization. The registered nurse demonstrates leadership by showing the commitment to continuous lifelong learning and education for themselves and others. They mentor their colleagues to advance the practice of nursing, the profession, and the quality of health care, and at all times treats all colleagues with respect, trust, and dignity. This next set of competencies actually reinforces some of the competencies that have been discussed earlier. Leadership requires the development of communication and conflict resolution skills, because healthcare will always be impaired, healthcare will always be of poor quality if the registered nurse cannot deal effectively with conflict. There's an obligation to participate in professional organizations. The nurse also must communicate effectively with the person with intellectual and developmental disabilities. How are you seeking ways to advance nursing autonomy and accountability? The two go hand in hand. The registered nurse cannot expect to practice autonomously if there is not strong accountability for their practice, and that includes achieving desired outcomes. The registered nurse participates in the influence of healthcare policy. In your practice, in your day-to-day practice, and in your specialization of the healthcare of people with intellectual and developmental disabilities, there is a vacuum of people who can help inform healthcare policy. We can't change healthcare policy and the bigger forces that are in play right now in healthcare reform, but we can be strident to make sure that all healthcare reform is responsive to the needs of people with developmental disabilities. The registered nurse must participate in groups that are making decisions. So that includes testimony to City Council, testimony and participation in even local professional organizations such as the Coalition, participation in support of self-advocacy organizations such as Project Action. There are many opportunities to participate and advocate in those ways. The registered nurse provides direction to enhance the effectiveness of the support team. This doesn't mean that you go it alone. You ideally want to partner with other people on the team. But if you find yourself in a work setting where there is a void in this area, you are obligated to step up and assume the leadership role. What you do as a nurse should be interpreted to others who may not appreciate the assessment, planning, observation, evaluation of healthcare needs. You should always, in all your work, promote the communication and information that advances the field of nursing. This can be through writing and publishing and presentation for both professional and lay audiences about the work that you do. Design innovations. This sounds like a lot of work to do, but it is also work that makes our profession exciting and dynamic. Standard 13. Standard 13 discusses those competencies that promote collaboration with the person with intellectual and developmental disability, their family, legal surrogate decision makers, and others in the conduct of nursing practice. Competencies that define collaboration reflect competencies seen in other areas. It requires partnership with others to produce positive outcomes. It involves the communication among the support team that of course includes the person with intellectual and developmental disability. The nurse is constantly observing for areas of conflict management and how to engage others to prevent or reduce conflict. And then participating with others in building that consensus to not only resolve conflict, but also to prevent it from occurring in the future. Knowledge of group process and negotiation needs to be applied to benefit optimal healthcare outcomes. The registered nurse has an obligation to adhere to all standards and codes of conduct that are seen within this set of standards and within our Nurse Practice Act to promote cooperation, respect, and trust. The registered nurse demonstrates and documents collaboration through a plan of care that focuses on outcomes and indicates the communication among the person with the intellectual disability and others on the support team. This defines our healthcare management plan that indicates the risk areas, the expected outcomes, and communicates effectively the collaboration that is needed in the description of interventions. The registered nurse is ready to engage in teamwork and team building processes and partners with other disciplines to advance the shared outcome for optimal health. At times when the registered nurse is implementing the nursing process and reviewing the stated plan of care for needed changes, those changes need to be communicated and discussed with other members of the support team, and then those changes documented along with the rationale for plan changes. The registered nurse at times may need to partner with the person with disabilities and others in the support team to determine that appropriate decisions are made about the utilization of resources in support of quality health. Standard 14 discusses the competencies needed to ensure that the registered nurse is evaluating his or her own nursing practice in relation to professional practice standards and guidelines, relevant statutes, rules, and regulations. The checklist that you were asked to download and to complete as part of this learning module embodies this competency. In developing the plan of care, the registered nurse ensures that all outcomes are age appropriate, developmentally appropriate, and also take into consideration the person's culture and ethnicity. The registered nurse engages in self-evaluation of their practice on a regular basis, identifying areas of strength and areas in which professional development would be beneficial. It is intended that through this module and the practice that you are implementing now in evaluating where your competencies are strong and where your competencies are needed to be developed further would meet this competency. The registered nurse who is strong in their practice obtains informal feedback from others about their healthcare implementation. This next set of competencies refers to the registered nurse's participation in a systematic review of their competencies. This is accomplished through peer review. It requires that the nurse needs to take action when certain areas of weakness are identified. The registered nurse must show evidence on why certain clinical practice decisions are made and what type of actions are taking part as part of both informal and formal evaluation process, and interacting with peers and colleagues to enhance professional practice. This is a team effort. It is an effort that does require self-reflection and the desire to change. At the same time, the registered nurse is providing peers with constructive feedback about their practice or role performance. Standard 15 asserts that the registered nurse who specializes in the health care of people with intellectual and developmental disability utilizes appropriate resources in the planning and provision of nursing services that are safe, effective, and financially responsible. While conducting a nursing assessment, the registered nurse must always take into consideration both the support needs and resources available to achieve desired outcomes. As part of that process, resources need to be identified that both support adequately the complex needs of the person and yet balancing the prevention of harm in the event that the needs are insufficient and not appropriately addressed. In the allocation of resources, the registered nurse also needs to contribute to designing a system that appropriately can delegate to unlicensed personnel within legal and policy parameters, and also doing it with safety in mind. As part of this process, the nurse will then need to evaluate how those resources are being used. Are they sufficient? At some point, are they becoming excessive or unnecessary? The registered nurse must also allocate for resources, including technology, that enhance nursing practice. If your agency expects you to have access to an electronic medical record, then you have to have access to computers that protect the health information and that allow you to do your work as efficiently as possible. With the advent of electronic medical records, there are a whole host of situations for which the registered nurse needs to be able to demonstrate innovation. The electronic records may require certain practices to be modified, will require the education of the person with disability and other members of their support team and family. It will require the registered nurse to keep abreast of what is possible within the realm of technology. The registered nurse also helps the person with intellectual and developmental disability identify those services that are appropriate to their needs across the healthcare continuum. So not only within their home setting, but also across other healthcare settings. In identifying appropriate resources, factors such as cost, risk, and benefit need to be taken into consideration. A good example of this is when a person has had a change in their health care. Does that require them moving to a more restrictive setting, perhaps interfering with some of the things that are important to that person? This is a time where, using the person-centered planning process, you really have to weigh what is important for the promotion of that person's health, and is it in conflict with activities that are important to the person. This certainly will require innovation in the identification of solution and strategies. This next set of competencies is something that oftentimes clinicians feel that they really are not a part of. They are not responsible for this. This is something that the administrators do. But within a collaborative setting that is appropriately using resources, it is everyone's responsibility to make sure that the work environment is conducive to getting the input of everyone on that support team to complete the identified plan and outcomes. This may include designing evaluation methods. How are we getting the input of direct support professionals? How are we getting the input of the person with a disability or their surrogate decision makers? And always keeping everyone informed about costs, risks, and benefits of care. The registered nurse specializing in health supports to people with intellectual and developmental disabilities conducts their practices in an environmentally safe and healthy manner. This next set of competencies related to environmental health are often put aside. We think of these as things that may be under the direction of the Q or the purview of the Department of Health or other monitors who come in to look at the environment. But it is everyone's responsibility, and certainly the registered nurse needs to take a front and center approach to the management of the environment. This may be an area where the registered nurse needs to attain more knowledge on what constitutes environmental health. What are some practices that we need to do to reduce or eliminate risks? Are there sounds, odor, noise, or light that threaten health? When I think about this, I reflect that these are often things that affect people with autism. They certainly affect people who have dementia, who may be very sensitive to sound. certain odors, noise, and light, and they also affect the frequency of a seizure disorder. So these are absolutely relevant to the practice of nursing. The registered nurse needs to be familiar with the use of products in healthcare. Are there any safety concerns about electrical products or certain products that are applied to the skin? Is there a danger of over applying or under applying certain prescribed treatments? And then communicating the information about environmental health risks to other people in the support team. And this certainly includes looking at what happens in the environment when there are days where there is a high risk of sunburn, or a high risk to people with allergies, or a high risk to people with asthma because of warm and humid conditions in the summer, just to name a few. The registered nurse uses scientific evidence to help inform whether a product or treatment may pose an environmental threat. The registered nurse has a role in promoting healthy communities, becoming part of health fairs in the community, or concerns that a community may have about toxic dumps or the presence of high-intensity electronic wires in the community. What is the community doing to monitor their own safety? The registered nurse needs to identify and assess, are there developmental or behavioral characteristics that predispose people with intellectual disabilities for an increased risk of exposure? This is especially evident if a person has a tendency to demonstrate the behavior of pica, or someone who may not be able to exercise the judgment of knowing when to come in out of the sunlight, or to be able to tell someone that they don't feel well today. The nurse needs to work with other members of the team to assess the home or work environment and identify potential threats. The nurse uses their knowledge of chronic health disorders to be able to distinguish the signs and symptoms associated with those disorders or disabilities, and what signs and symptoms may be associated with harmful environmental exposures. Nurses are familiar with conducting tardive dyskinesia screens, but there certainly could be a exposure to something toxic to the neurologic system that may come from outside of pharmacology, and could be something coming from the environment. And the nurse is part of the support team to prevent or minimize environmental health risks. This is particularly important, and probably some of the more frequent things that we see are falls associated with the use of carpeting in the home, or perhaps something in the home that is in need of repair, making sure that adaptive equipment, especially wheelchairs, are maintained properly. So there are a lot of areas here where the nurse collaborates with other members of the support team to be on the lookout and always to prevent any environmental health risks. This portion of Module 2 will deal with specific portions of the DC Nurse Practice Act that relate to the practice of developmental disability nursing. It is the responsibility of the registered nurse to be familiar with all aspects of the DC Nurse Practice Act. The practice of nursing in the District of Columbia is defined as the performance of acts requiring substantial specialized knowledge, judgment, and skill based upon the principles of the biological, physical, behavioral, and social sciences. The next portion of this module will discuss aspects related to the nurse's responsibility for observation, plan development, specific nursing functions, medication administration, the nursing process, and delegation. Under the requirement of observation, the registered nurse is responsible for executing a comprehensive assessment. More information about the nursing assessment will be discussed in Module 4. The nurse is responsible for evaluating and recording all physiologic and behavioral signs and symptoms of health, and that includes mental health, disease process, and injury, and requires the performance of examinations and testing of their evaluation in order to identify the needs of their client and the client's family, if applicable. So I hope that you will begin to see that many of the aspects covered in the health and wellness standards from DDA are still the nurse's responsibility, even if those health and wellness standards did not exist. The requirement of a comprehensive assessment and the evaluation of signs and symptoms is written, and the obligation begins with the DC Nurse Practice Act. The registered nurse is responsible for the development of a comprehensive nursing plan. This plan establishes nursing diagnosis or areas of health risks. The plan sets goals, or in the instance of the healthcare management plan, identifies expected outcomes that are related to the identified healthcare needs of that person. The plan sets forth a prescription for the implementation of interventions, those interventions that are under the purview of the registered nurse or the licensed practical nurse, as well as those interventions that are delegated to other unlicensed personnel. These interventions will relate to therapeutic interventions, interventions that are intended to prevent other problems, and in the case of disease, restoring the person to their baseline health status. All of these interventions are in response to the assessment of the person's individualized needs. As a registered nurse, it is within your purview to provide services that include counseling, advocacy, health education, assessing and implementing measures that promote a person's safety, comfort, their personal hygiene, and protection. Interventions also should be developed that prevent disease or prevent injury and promote optimal health. These interventions may be of a psychotherapeutic nature and also include referral to other specialists and consultation with other disciplines. The registered nurse has a responsibility for the administration of all medications and treatments that are prescribed by a legally authorized healthcare professional. For people with intellectual disabilities, the registered nurse must also be familiar with and adhere to all regulations pertaining to trained medication employees. When examining Section 5414.1 of the DC Nurse Practice Act, it would be very helpful to reflect upon your own clinical practice. Are your nursing services including the following? How are you delegating and assigning nursing interventions to implement the plan of care? That should be part of the healthcare management plan, but the actual delegation or assigning for LPNs, the interventions, also requires management, supervision, evaluation about how the staff who are receiving the delegation are able to implement your recommendations. This may require the nurse to develop organization-wide healthcare programs. There may be programs that are going to address obesity, for example, or oral health care. Are the interventions that you expect your staff to implement covered in policy and procedures that clearly outline responsibilities? Have you developed the plan of care? How are you conducting activities to continually assess, measure, and evaluate the nursing care that is being offered, your own nursing care and that nursing care that is delegated to licensed practical nurses or unlicensed professionals on the support team? It's the nurse's responsibility in the administration of nursing services to make sure that the environment maintains a safe and effective atmosphere for the provision of nursing care. And finally, it is the registered nurse who is responsible for the education and training of people, both in direct and indirect nursing care of the person. Continuing on with the administration of nursing services, it also includes evaluating responses and outcomes to the interventions and effectiveness of the plan of care. You should begin at this point to see a thread between what we began talking about in this module of the nursing process and the full process of continuing to evaluate the person's response to your interventions. Are they able to achieve the outcomes that have been delineated in the healthcare management plan, and do modifications need to be made in order to achieve success? Communication and collaboration with other healthcare team members. This is something that we spent quite a bit of time discussing in the American Nursing Association Scope and Standard of Practice for nurses in intellectual and developmental disability nursing. These are not some abstract items that come or are generated solely from the DDA health and wellness standards. These are standards that are well integrated into our own Nurse Practice Act, other professional standards of care, and the DDA health and wellness standards. The registered nurse, finally, is responsible for acquiring critical new knowledge and the application. So again, that concept that we discussed earlier of lifelong learner, and not only then accessing the information, but what are you going to do with that information? How are you going to apply that information so that the supports that you provide for the promotion of optimal health care are achieved? The DC Nurse Practice Act requires all registered nurses to wear a picture ID that identifies them as a registered nurse. This comes from concern for consumers of health care to know that the person who is providing their nursing care is in fact a registered nurse. This next set of slides, and actually this is now the final portion of this module, will be devoted to the delegation of nursing interventions. In community settings, and particularly in settings that are supporting people with intellectual and developmental disabilities, most of the time the nurse is working with people who are exhibiting their baseline of health. So for example, someone may have a seizure disorder. It may actually be an intractable seizure disorder, in fact, but that person is still expected to be able to function in the community, because we recognize that having seizures is part of who this person is. Our role is to help them manage it to the most effective way possible, allowing them to interact with their peers, with their community. At the same time, the person may require quite a bit of nursing, medical interventions to help support their nutrition, to make sure that their skin integrity is maintained. But again, it is rarely a setting where the registered nurse is expected to be there 24 hours a day, 7 days a week. So therefore, the registered nurse is often in the position of assigning tasks to another licensed professional, particularly a licensed practical nurse, or they are delegating interventions to an appropriately trained and qualified direct support professional. The Nurse Practice Act reminds us and requires us that the registered nurse is the one who initiates the assessment. The initial assessment can never be delegated or assigned to an LPN. The registered nurse, once the initial assessment has been completed, however, can assign the LPN or a direct support professional to monitor how that plan of care is going and to collect data for the RN to be able to evaluate the effectiveness. It is the registered nurse who develops the healthcare management plan and identifies those services that can be safely performed by unlicensed assistive personnel. And in the healthcare management plan that is required by DDA, we in fact have a separate column that identifies those interventions that are going to be carried out by the direct support professional. But remember, the delegating nurse has that responsibility for assuring that there is adequate care provided, and the registered nurse is the person who has that accountability for the nursing task. Our DC Nurse Practice Act requires not only is the delegation and assignment of responsibilities documented within a healthcare plan, the nursing service, the organization that employs the nursing staff and the unlicensed personnel must also have policies and procedures in place. And those policies and procedures do two important things as it relates to delegation. Policies and procedures identify who are those people by their position title and job description to whom nursing interventions may be delegated. Those job descriptions and position titles have to take into consideration the person's education, the training, and the ongoing measurement of their continued competency. Policies and procedures should be able to assist the delegating registered nurse to verify the competency of the trained unlicensed personnel prior to assigning a nursing intervention. So therefore, your agency may have a policy that says that until people achieve certain competencies by training modules and observations, they can't even be assigned to something. You should be familiar with the DDA training policies that do mandate certain modules that must be completed before a person can assume responsibility for care. There are also regulations within the trained medication employee that also tell you who is eligible to be a TME in the first place. If in the process of assessing a staff member's competency, the registered nurse determines that that person cannot safely perform the nursing intervention, then the RN shall not delegate. This is not the responsibility of the Q, or the program manager, or even the executive director of the agency. It is the registered nurse's responsibility to articulate if someone is not competent to perform the nursing intervention. So even if it is in your agency's policy that a certain level of employee is allowed to complete an intervention, if that employee that day is not competent to perform that intervention, the RN is the one who determines that at that point that person cannot have that task delegated to them. The DC Nurse Practice Act is very clear that a nurse can only assign or delegate a task that is, number one, within the scope and practice of the RN. It is a task that the RN determines can in fact be safely and properly performed by the direct support professional. And third, be a task that any other reasonable and prudent nurse would find within the scope of sound nursing judgment. Once the registered nurse has determine that the intervention is in fact within the scope of practice, can be safely and properly performed by an unlicensed personnel, then the delegating nurse must assess and evaluate the person's condition. Again, you have to go back to the healthcare management plan. What are the person's goals? What are the person's care needs? What are the required interventions? This should all have flowed from your initial assessment and be documented in the healthcare management plan. You are then going to review that set of interventions that you plan on delegating to the direct support professional and determine that, in fact, these are interventions that do not require critical thinking or independent nursing judgment. The tasks that are delegated should be tasks that are routine, the collection of data, the observation of a person at a certain part of the day, the conduct of activities such as bathing or turning and positioning. These are all things that can be outlined in a protocol and do not require critical thinking. The nursing interventions are those that should pose a minimal risk. At all times, the direct support professional or the trained medication employee is practicing under the general or immediate supervision of a registered nurse. So these tasks aren't something that can be assigned at one point in time and then the nurse never goes back to again review the health plan. Has there been a change? Are the interventions effective? Are they in fact being implemented the way they were designed to be implemented? This is why we have regulations, for example, in intermediate care facilities that are compelling us to do quarterly reviews. But again, the decision about how often a person's status needs to be reviewed is something that is a critical judgment that can only be done by the registered nurse. So the intermediate care facilities tell us at a minimum, if there is no change, you must do a review. But in fact, those reviews need to be done as frequently as the person's condition changes. And you can see here how we have quite a dance between the registered nurse and other unlicensed personnel on the team who are those people who spend the most time with that individual. You can see why we need really strong and effective communication so that the nurse is able to continually perform assessments. Let's look now at supervision in delegating nursing interventions. The registered nurse is required to provide supervision in teaching the direct support professional, in monitoring their performance, in verifying how they are implementing the task that was delegated to them, and evaluating the outcome. In evaluating the outcome, you see that it brings us back again to the nursing process and the need to evaluate the outcome, in the identification of a measurable time-limited outcome in the healthcare management plan, and then determining how is the person doing in meeting that expected outcome. Is one of the barriers of achieving that expected outcome related to the accuracy with which the direct support professional is able to implement the designated intervention? The degree of supervision that is required by the registered nurse is outlined in the Nurse Practice Act, but the specifics are not. Again, this requires the registered nurse's critical thinking skills. The registered nurse must first look at the person's stability. So someone who recently recovered from an injury or is recovering from a surgical intervention will need more supervision. Someone who has been diagnosed with a chronic illness that is expected to result in a deterioration of health is going to need more supervision. The nurse also has to look at the person's willingness or ability to be involved in their own care. This is often affected by someone perhaps with a mental illness that is not well controlled. They may not see the importance of adhering to a certain health protocol. That will require additional supervision so that the nurse can determine, has this person's health status reached some critical point where additional intervention is needed. The registered nurse also has to learn about the experience and competency of their direct support professionals and trained medication employees. This is quite a challenge given the turnover that often exists with this group of people, and also the turnover in registered nursing staff. But it is something, again, that until you are learning and becoming more comfortable with the direct support professionals, you will have to provide more supervision. And then finally, the nature of the intervention itself. Is it a complex intervention that will require additional supervision until you are assured that the direct support professional is competent to consistently perform that intervention? The Nurse Practice Act currently requires that a delegating registered nurse is responsible to make supervisory visits at least every 2 weeks. And those visits need to include the evaluation of health status, evaluating how the unlicensed personnel are performing those delegated acts, determining if goals are met, and evaluating the continued competency. This is quite a tall order, particularly for community visits, but it really does tell you that the registered nurse has to really sit and look at their own requirements within their practice, looking at the hours in which you are performing your work and making sure that they are matching up with the hours in which the direct support professionals are working, and really requiring you, again, to use really good critical judgment in managing your practice. Here is a list of those nursing functions that can never be delegated. The initial nursing assessment, as we discussed, and an initial nursing assessment is required once there's been a change in the condition. So that initial nursing assessment that is required when someone comes back from the hospital, for example, can never be delegated to someone else. Any type of comprehensive nursing assessment that is required on an ongoing basis for someone who is unstable, for example, must be done by the registered nurse. Only the registered nurse can develop the nursing diagnoses, establishing what the goals are of nursing care. So even though that's done in collaboration with the person, it has to be established by the registered nurse. Evaluating the person's progress. You may have other staff providing you with data, or you're reviewing the data from other professionals that help you come to that evaluation, but that final evaluation that a person is meeting their goals must be done by the registered nurse. Any type of counseling or education done directly to the person or family about their health care, and coordinating and management of care. Again, this is certainly done in collaboration with other members of the team, but when it comes to triaging healthcare needs, deciding when a consultation is needed with the primary care physician, the specialist, or sending to the emergency department must be done by the registered nurse. Any kind of advice that is given to the person or family related to their health care. And again, any nursing task that does require nursing knowledge, judgment, and skill. The Nurse Practice Act makes it clear that the delegating nurse ultimately retains full responsibility for medication administration, although in situations involving people with intellectual disabilities, those medication administration tasks may be delegated. For these responsibilities, you need to refer to the Trained Medication Employee Regulations. It is the Nurse Practice Act that gives these following constrictions or prohibitions around the delegation of medication administration. The following functions can never be delegated to an unlicensed personnel: the calculation of a medication dose, the administration of an initial dose of a new medication, the injection of medication with the exception of an EpiPen, the administration of intravenous medications, the administration for intermittent positive breathing or other mechanical device for the inhalation of medications, tube insertion of medications in a body cavity, or investigational drugs or blood products. In summary, the act of delegation involves the transfer of responsibility for the performance of a task from one individual, the registered nurse, to another, the direct support professional, while the registered nurse retains accountability for the outcome. The DC Practice Act states that the delegating nurse shall be responsible at all times for all nursing interventions provided by unlicensed assistive personnel that are delegated, and it is the registered nurse that is subject to disciplinary action by the DC Board of Nursing. This statement implies that the disciplinary action would be initiated if, in fact, the registered nurse did not follow the steps that we previously discussed in deciding what actions can be delegated and how those actions and interventions are appropriately supervised.